Please welcome my next guest, Dr. Phillip Kahn, who's a plastic surgeon with Novant Health Coastal Plastic Surgery, located in Southport. Welcome to the show. Welcome back to the show. I love when you're here.
Thank you very much. It's good to be here.
Yes. So we're going to jump right into it. And I know that you've told me and others that you were inspired to become a physician because of your dad and your mom. Your dad was a surgeon with Novant, Brunswick Community Hospital for a very long time, and your mother was a nurse. So tell me a little bit more about that. How did that affect you, and how in the world did you become a plastic surgeon?
It affected me really well in the fact that we're such a small community,
Right.
and it was a unique practice that they had, with Dad doing general surgery as well as general practitioner work. And it was really unique in that my mother was the RN and the nurse that ran the practice.
Yeah.
So I got the full scope of care and what they really provided, not only medically, but just as leadership roles in the community. And that really sort of molded me for wanting to kind of carry on that tradition and being embraced in the community. And it led me eventually to kind of forge my own path into plastic surgery, and allowed me to find a path to be able to be creative and provide similar types of care for patients, but just on a broader scale.
I knew your father fairly well. He used to come to lunch. The old hospital was located right across from his office, and I would see him every day at lunchtime. And he was a special man.
Yes.
He was a very special man, as is your mother. I mean, I know your mother, and I love seeing her around, and you had some great parents.
Absolutely.
Yeah.
Absolutely.
So let's talk a little bit about what your role as a plastic surgeon entails. A lot of people, when they think plastic surgery, they think just cosmetic surgery, but there's so much more to it.
Absolutely. You know, there's a lot of things that are much more than just the cosmetic focus that we have. We provide a wide variety of things, from skin cancer surgery to things such as basic hand surgery, on top of all the cosmetic things. And a big part of what we do are the reconstructive surgeries, whether that be for broken bones in the face, broken bones in the hands, or even things such as reconstruction for cancer, most commonly here, breast reconstruction. With that, there are also some things that patients feel that are cosmetic that are treated by us that can be helped as well, that are actually functional. The main thing here are women with large breasts that have had histories of neck pain, back pain, shoulder pain, that really they don't want to present sometimes because they don't want to get labeled as having a cosmetic procedure, but it's functional in nature. The others are things such as excess eyelid skin, droopy eyelids. That's a functional concern that can affect people's vision that we really treat quite frequently as well.
I know that there are so many people that have been affected in one way or another by breast cancer, and your work in reconstruction is so important to these women. So what about that, what makes that so meaningful to you?
To me, I think it really offers probably the highest honor a provider of any type of care, whether it be medical or whether it just be socially in general, to be selected by that patient to go on that journey with them. And it really touches the heart in doing that, because you present things, you say how you're going to reconstruct, but it's an honor to be chosen by that individual patient to say, not only am I taking this journey and my family are taking this journey, we're allowing you to be on this journey with us. And that provides energy for me to be able to focus and really just continue to provide that care for patients.
I'm going to be really honest here. I have been through that journey with you, and I found you to be my best friend during this whole process. And it is a very important role that you do play in that process. So I can attest to that. And it was obvious to me how meaningful it was to you,
Yes.
that you felt very special in being able to treat me. And I thank God every day that you were there. And I don't want to embarrass you. I'm just embarrassed myself. But
Absolutely. Yes, ma'am.
so I know that you treat other areas. So tell us more in what situations you may play a role in plastic surgery that we may not immediately think of.
Very good. You know, a lot of things that we don't immediately think of are some basic hand surgery type things. Things like people that can have what we call trigger fingers or even little lumps or bumps on their hands. We actually treat that. In this community, I do simple things in that area. And really, we have a lot of skin cancer treatments that we do. We don't necessarily do full body skin surveillance, but things that someone says this mole doesn't look right to us. And really treating that cancer primarily and then reconstructing that or providing other care that needs to be done after that as well.
How does it make you feel practicing in a community where you grew up?
It's a circle of life, most definitely.
Yeah.
It's most definitely, and really blazing your own trail through that. I mean, my mom's still pretty prominent in providing care
She
still
sure
in the
is.
community. She's still going very strongly, but really means a lot being able to provide care for family members of patients that were my parents' patients. You know, some of them are in their 90s, and I'm kind of coming back and I'm treating their grandchildren and great-grandchildren, and it really is, that's the most satisfying thing. And here it helps because I can do such a broad range. I don't have to be the eyelid surgeon, or I don't have to have a niche in something like breast reconstruction or just breast surgery. I have the full focus and can broaden anything that I want to do here.
Yeah, and I think that's very important, especially in a place like this, because it's just people from all walks of life.
Absolutely.
And have varying degrees of deformities or diseases or whatever. So you got a good cross-section here.
Across the board, yes.
So when we've talked about this in the past, how you prepare for a surgery. And so can kind of explain to our viewers the process that you go through prior to the surgery, which is a long process itself.
And I do this with every process because I believe in really pounding the basics of everything, hitting every checkpoint, and then all of your other creativity kind of falls into place. The process really begins after I've seen the patient and we come up with a plan of what type of the surgery is going to be and what type of reconstruction. Then it's exhaustive preparation, looking at photos, looking at measurements, and really understanding that each different patient has their own unique presentation. It's not all numbers based on a certain patient A reconstruction or certain patient B. And it's hours of preparation each weekend for the week ahead of, this is the type of implant I would like to use. These are the type of reconstructive procedures I'm going to use. And every plan A has a plan B, which has its own subset of plan A, B, and C as well. So it's a lot of things going through the head, but it starts with just having those basic steps, looking at the patient's medical history, looking at the patient's care that we're going to give in the operating room, but most importantly, preparing to look at how they're going to have aftercare. Are they going to? Do they live alone? Are they going to do they have a lot of kids? Do they have a lot of dogs they've got to walk? Because we don't want them tripping over and falling, and those are all part of the process in the planning itself.
That's funny. I remember all those questions. All those. And speaking of questions, if somebody's contemplating having a plastic procedure, what kind of questions should they ask you? And on the other side, what questions do you ask them?
The main questions that they should start out with are, do we feel that they're a good candidate for surgery? Whether that's cosmetic, which is definitely because that's an elective procedure, or if they're healthy enough for the reconstruction that we're going to have. The other questions that are important are what things they can do ahead of time to help increase their chances of healing. And also what things they're going to to be prepared for afterwards in terms of how long am I going to need someone with me at home? Am I staying overnight? Am I going home? But the most important thing that they should really ask is whether their plastic surgeon is board certified by the American Board of Plastic Surgery. And that is a big thing because there are a lot of various boards that aren't necessarily that board. And it's important that we underscore that because it's the pinnacle of patient safety and care, and it really helps us to become advocates for the patients. So
You're a very strong advocate for your
Absolutely.
patient. I can attest to that. I heard something the other day, I think I saw it on the news or something, about high impact exercise and how that can lead to aging skin. Is that really something?
I have to be honest in that I don't necessarily think that that's something. I think it may be something related to if this high impact is out in the sun with no sun protection.
So like a runner might,
Absolutely.
because they're just in the sun all the time.
Absolutely.
Yeah,
And-
that was kind of strange. And it had something to do with the gym, and I'm like, you're inside. What's going to happen?
absolutely.
You might break your ankle or something, but
I think it's a part of many different news outlets that are making things to where it might be that people just don't want to exercise really hard. With that though, and all joking aside, is
Yeah.
that I really think it's important that moderation is the key to any of these
Anything.
things. It's just movement.
Yeah.
Movement is the first step to keeping someone young and healthy.
Okay, well, let's kind of switch gears and let's talk about product. If you would decide to have Botox or any of the fillers, is that a one and done process, or do you have to have it done over and over?
Typically, for instance, something such as Botox is something that needs to be treated roughly every 3 to 4 months for it to have an effect. Because Botox is something that helps to paralyze certain areas of muscle so that we don't develop fine lines. Things such as fillers, which are things that help fill the skin, typically are ones that last about 9 to 12 months. So it's something that really helps that you have to get repeated with time.
So it's an ongoing
Yes,
thing.
ma'am.
And once you start it, you probably don't want to stop anyways. You probably
Quite
love
often,
your
but
product.
there are a few products that I think that with the more that you inject them and keep them consistently. For instance, something such as Botox, there are good studies and even my own analysis with our patients that sometimes it's not necessarily that definite every 3 months. It can get extended to 4 or 5. And many times less toxin needs to be used to create an effect.
Oh. Since the pandemic, when the pandemic hit, a lot of people went virtual for everything. And I think we continue now. We Zoom a lot. Did you see an increase in your patients, volume patients of people who didn't like what they looked like on screen?
You know, nationally, people saw quite a bit of changes
Really?
with that. And we had actually begun to see that even before the pandemic, many years
Really?
ago, because of phones and people looking down on their phones all of the time. So they noticed the skin of the chin sagging. But with the Zoom nation, I call it, you've seen a lot of different changes because people are focusing more on their face, but at the same time, the camera angles create a distortion that people aren't recognizing as well. So
Wow.
those are things that have really have become an uptick from the sort of Zoom nation, I call it.
Yeah. Tell me who would be a good patient for plastic surgery, for facial plastic surgery. Who is a good patient?
First and foremost, someone that's healthy and that can tolerate surgery. Second of all, someone who's willing to become a part of the team,
Oh,
willing to be able
Yeah.
to understand that there's a process that's involved and it's not a one and done type of, there are many appointments afterwards. Someone that's going to be able to take care of skin afterwards, and someone that's going to be able to help with the team create a plan so that they can best follow directions to increase their chance of care being what they want.
well, I have so many more questions, but you're going to have to come back.
Absolutely. I would love to.
Thank you so much for being here again. We love having you. So let's get you back on the schedule.
Anytime.
All
Thank you
right.
very much.
You're quite welcome.